I am 26 years old. I'm younger. I grew up showing horses, and I had an injury where I injured my L4 and L5 vertebrae in my lower back. Would I be a good candidate for prolotherapy?
Possibly. The key to prolotherapy is if you have point tenderness in your lower back. Some people think prolotherapy is helpful for a herniated disc. Actually, I disagree with that. It's too invasive a procedure. But if you have areas on your back where you say, I know exactly where this hurts. Oh, gee whiz, I bend over and this hurts me all the time. Or I'm lying in bed and I can't get to sleep because I can feel where this pain is. Prolotherapy is really very appropriate because when we give you the injections, we give them at the point of pain because that's telling us where the ligament's damaged or where the tendon's damaged. So it works really well.
Now for some older relatives of mine, I'm not going to say the age, but he often experiences shoulder pain, can't really do heavy lifting. It may not necessarily be diagnosed as arthritis, but could prolotherapy help him relieve that pain?
Yes. Matter of fact, let me tell you a little story. I had a woman come to me who could not raise her shoulder. She had severe arthritis. She also had what's called adhesive capsulitis. The shoulder was stuck down. She came to me and asked, would you do prolotherapy for me? At the time, I was a little skeptical to promise anything. I gave her the injections, also an intensive physical therapy program to get her shoulder moving again. Let me tell you something. She is my favorite patient now. She is so happy. She has not 100%, but 90% of the motion of her shoulder, which most people would be more than happy with, and her pain has gone away. I didn't believe it so much that I took another x-ray, and actually some of the arthritis was decreased. Really. I had another woman who had a torn rotator cuff who refused to have surgery. She refused to have surgery. I said, okay, I'll treat you. She had an MRI which showed the rotator cuff. We treated her. She came back 3 months later like this.
Oh, wow.
I said, do you mind if I do another MRI? I'll pay for it myself. She said, no, fine. The MRI report, no rotator cuff tear, was completely healed.